What are urodynamic studies for urinary incontinence? Imagine trying to understand how your bladder works, much like testing a plumbing system to find out where a leak might be happening. Urodynamic studies are a set of specialized tests that help doctors see how the lower urinary tract functions. This includes the bladder, the tube that carries urine out called the urethra, and the muscles that control urine flow. These tests are especially important when someone experiences urinary incontinence, which is when urine leaks out involuntarily. By understanding how the bladder stores and releases urine, healthcare providers can figure out what's causing the problem and decide on the best treatment options. There are several types of urodynamic tests. The first is uroflowmetry, which measures how fast urine flows when you urinate. This can show if the bladder muscles are weak or if there's an obstruction blocking urine flow. Next is the postvoid residual measurement, which checks how much urine remains in the bladder after urination. This is often done with an ultrasound or by inserting a small tube called a catheter into the bladder. Then there's the cystometric test, also called a cystometrogram. It measures the pressure inside the bladder as it fills with water or sterile fluid, helping doctors see how the bladder responds to increasing volumes. Another test is the leak point pressure measurement. This looks at the pressure at which urine begins to leak, which helps identify stress urinary incontinence, often caused by weak pelvic muscles or sphincter issues. The pressure flow study combines measurements of bladder pressure and urine flow during urination, providing insight into how well the bladder contracts and whether the urethra opens properly. Electromyography, or EMG, measures electrical activity in the pelvic floor muscles, helping to diagnose muscle coordination problems. Some clinics also offer video urodynamic tests, which combine imaging techniques like fluoroscopy with the other measurements. This allows doctors to see a moving picture of how the bladder and urethra work during filling and voiding. These tests are crucial because they help distinguish between different types of urinary incontinence. For example, stress incontinence happens when pressure on the bladder causes urine to leak, often during coughing or lifting. Urgency incontinence involves a sudden, strong urge to urinate, sometimes with leakage before reaching the bathroom. Mixed incontinence combines features of both. Knowing the exact type helps doctors tailor treatments, which might include lifestyle changes, medications, or surgical procedures. In the context of prostate health, urodynamic studies are especially helpful. Treatments for prostate cancer, like surgery or radiation, can sometimes damage the urinary sphincter or other parts of the urinary tract, leading to incontinence. Urodynamic tests can assess how much damage has occurred and guide rehabilitation or further interventions. They are also useful for men with benign prostatic hyperplasia or enlarged prostate, which can cause urinary symptoms similar to those seen in prostate cancer. Overall, urodynamic studies are a vital tool in diagnosing and managing urinary incontinence. They provide detailed information about how the lower urinary tract functions, helping doctors develop personalized treatment plans. If you or someone you know is experiencing urinary issues, it's important to consult a healthcare professional who can determine if urodynamic testing is appropriate. Remember, every person's situation is unique, and proper diagnosis is key to effective treatment.